We all love to look and feel our best, and if you're thinking about a cosmetic procedure, you need to make sure that you deal with an expert, someone who is the very best in the business. And of course, today we have our coastal expert here with Renewal MD, Dr. McGovern, and we're going to be talking about breast augmentation. Hi, Dr. McGovern. It's great to see you.
Great to see you too. Thank you.
So, breast augmentation, it's been around for quite some time, but it has changed over the years. I mean, I know that there are different types of implants now. You have gel implants and also saline implants. So what's the difference?
The shell of both of them is the same. So it's a solid silicone shell. Saline implants we fill with saline back there on the OR table. So one of the positives about a saline implant is we can customize the size because we have a size range to work with. Gel implants are silicone gel. It's a cohesive gel that acts like one molecule, and it's nice and soft and supple, and it feels more like breast tissue. That's why they're back.
And and the thing about it is, a lot of folks, when they hear the word silicone, they get really, really anxiety and, very scared of silicone. But it's really changed over the years.
It's changed significantly over the years. The old silicone implants were liquid silicone. So if they ruptured, if the shell broke, liquid silicone could leak into the tissues and could cause some inflammation and irritation and could cause trouble. The newer silicone implants, like I said before, are cohesive, and they want to act like one molecule. So if you get a hole in a silicone implant now, instead of leaking out, they just stay as one piece. So they don't want to leak out.
So it sounds like literally you could take a knife and cut it into pieces, and you would have those pieces without anything oozing into your body.
If you cut it in half, you have two halves.
Two halves.
Right.
So it really has changed, and it's you don't have to be fearful of a breast augmentation these days.
Absolutely. It is the most studied device on the planet.
So what about, where implants are concerned, the size is based on cc's. Now, does this correspond with cup size?
Yes and no. It is, we have different sizes and shapes of implants, but we're fitting it to the patient's chest wall. So the same amount of breast tissue on one person with a tiny, tiny chest wall and no breast tissue is going to be a different cup size at the end than someone with a bigger rib cage and a different amount of breast tissue to start with. So it's a very custom process, and we're trying to get inside the patient's head and find what they're looking for. But the same size implant on one person would look totally different on another person's chest. So we find what fits that person and makes them feel most comfortable.
Regarding the type of implant, if we're thinking about in terms of gel versus saline, is one better than the other?
It is really saline is a little bit less expensive, and everybody's got a budget, and the cost, is part of the conversation. Saline feels more like a water balloon, but it's hidden up under the tissues. Silicone feels more like a breast tissue. It feels more like breast tissue. So the difference is mostly how they feel. The difference also is how we put them in. So silicone comes pre-formed and the saline comes empty, like I talked about before. From a surveillance and follow-up standpoint, there is some more follow-up and surveillance that we do on silicone implants just to be cautious and safe. And those are the main differences.
So for folks watching right now, maybe they are considering having a breast augmentation. What is the procedure like? I mean, what can they expect?
It's an outpatient procedure. So you go absolutely. Go home the same day. You come in the morning of surgery. You have anesthesia so that you're comfortable and not aware of what's going on, but you're breathing on your own. And then we do the procedure. I put at the end of every procedure, but particularly procedures like this, I want people to be as comfortable as possible. So I put numbing medicine in right at the end so they wake up as numb as possible. There is some spasm in the beginning. The muscle, most of the time I put the implant underneath the muscle because the muscle helps hold it up better. So it looks better long term. There's some other safety things that are good about that as well. But that has some spasm in the beginning that takes a little bit of time to settle down. So they start out a little high and then they settle into the right position over a number of weeks. Most people take 4 to 7 days off from work or school. And it takes time for it to look and feel natural and like part of you.
Now, and some folks have to wear drains and some don't.
It's very, very unusual to need a drain after a breast augmentation. It happens occasionally,
And what
but
causes
it's not
that?
typical. If in a standard breast augmentation in a young, healthy person who's not on blood thinners, it's extraordinarily unusual to need blood thinners. In reconstructive situations where things are more complicated in the setting of cancer and reconstructive type concerns, much more common to need a drain. But in the typical augmentation patient, I would say that's very unusual.
So now we want to make clear too that there are different types of procedures, because I know that
absolutely.
sometimes you have folks who come in just for a breast augmentation, but sometimes you also do a breast lift in addition to the breast augmentation. Can you talk about that?
Yes, and it really depends on what the tissues are like to start with. If you've had children, if you've had weight changes, if the shape of the breast isn't what you like, and it's not sitting up on your chest wall anymore where you want it to be, then sometimes you need it lifted back up where it belongs.
Of course, Renewal MD, you guys are the very best at what you do. What would you like to say to them? If they're thinking about breast augmentation, what do they need to do and why should they choose Renewal MD?
Well, the first step is make an appointment for a consultation. And we have sizers, we have before and after pictures. We have a conversation about what your goals are and what you really want to accomplish. I think you have to connect with the plastic surgeon that you're working with and that's going to help you. If I'm the right person, I want to be there for you and take care of you. So come see me.
And that all it takes is a phone call or checking out the website. Thank you so much, Dr. McGovern. It's great to see you and all the information that you provide us.
Thank you.
If you'd like more information on Renewal MD or any of our coastal experts, just go to our coastal experts page. You'll find that at wsav.com.